risk of famine in Gaza is increasing with deliberate withholding of humanitarian aid, including food, in the ongoing blockade. And the latest food security analysis by the Integrated Food Security Phase Classification Partnership shows that indeed the entire 2.1 million population Gaza is facing prolonged food shortages, with nearly 500,000 of people, if the situation persists, in a catastrophic situation of hunger, acute malnutrition, starvation, illness, and death. Since the aid blockade began on 2 March 2025, we get reports from the Ministry of Health that 55 children have reportedly died from the effects of malnutrition. And if the situation persists, again, this dire situation persists, nearly 71,000 children under the age of 5 are expected to be acutely malnourished over the next 11 months. People are trapped in this whole cycle where a lack of diversified food, while malnutrition and disease fuel each other. Healthcare increasingly out of reach, vaccine coverage, of course, plummeting, access to clean water and sanitation severely limited. 90% of the Gazans lack access to safe water. And increased child protection concerns is always, of course, the most vulnerable who get hit first. So the risk of severe illness and death grows, especially for children suffering from severe acute malnutrition who urgently need treatment to survive. WHO calls for the protection of healthcare, for immediate end to the aid blockade, which is starving people, obstructing their right to health, and robbing them of dignity and hope. Hope. WHO and has repeatedly stated that calls also for the release of all hostages, for a ceasefire which leads to lasting peace.